This paper actually looks at the Medicare population in its entirety. That's about 45 million seniors and disabled folks. The database we're working with is actually a 10-year, not even a sample, 10-year database of every single hospital admission that Medicare pays for. About 10% of all the seniors per year go to a hospital at one point in time. And what we do is we actually measure whether or not someone is getting an injury or some other adverse event while they're in the hospital. And the thought is if the hospital has invested in information technology over a period of time, the chances of those injuries should be going down and thus creating value for the consumer. We found that it's kind of it's a mixed bag response. If we just go outright and look for it and say, okay, did you invest in this technology, and now do we see a reduction in these patient safety issues? We didn't really find much of an effect. And then we went even further and said, okay, let's adjust for how sick people are. Do we see much of an effect? Let's even look at some of the criteria that the administration has put in place to say you need to be qualified. Do we see an effect? We didn't. When we actually turned our attention to say, okay, what if the person is really clinically complex, meaning lots of specialists are involved in their care? Finally, there we see a big effect. We actually see that people do get better care when these systems are backing them up. And when you think about it, there's only so much a doctor and a nurse can remember, so this is where the systems really can have their value. There's a lot more energy that's going into this research. There's a lot more money that's going in to sort of see what these systems can look at. This actually has gotten a lot of interest in Washington to sort of say, okay, this is giving us a hint as to where to look to see where the results are, given that the obvious things we thought we'd find weren't there, and people are now trying to figure out, well, where will it really make a difference?